A 17-year-old girl comes to the office for emergency contraception. She had unprotected sexual intercourse last night and is worried that she may become pregnant. Her last menstrual period was 1 week ago, and she has had regular menses since menarche. Physical examination is normal and urine pregnancy test is negative. After various emergency contraceptive options are discussed, the patient asks for a pill option and that her parents not be notified about this visit. What do you do? Patients with recent unprotected intercourse may be candidates for postcoital or emergency contraception or EC for pregnancy prevention. Patients with a positive pregnancy test are not candidates for EC because implantation has already occurred. In contrast, patients with a negative pregnancy test are still at risk for unintended pregnancy and are candidates for EC. The levonorgestrel pill, in other words, Plan B, is the most readily available form of EC. The high dose of progestin in these pills prevents pregnancy by inhibiting the LH surge, thereby delaying ovulation. Additional mechanisms include cervical mucus thickening and thinning of the endometrial lining. Levonorgestrel pills are highly effective up to 94%. However, effectiveness decreases over the course of 72 hours as low as 59%. Therefore, levonorgestrel pills should be provided as soon as possible after unprotected intercourse. Most states allow adolescents to receive confidential care for contraception, pregnancy, and sexually transmitted diseases without parental consent. In patients with a positive pregnancy test, in other words, implanted pregnancy, misoprostol or prostaglandin E1 can be used for medical abortion or pregnancy termination by stimulating uterine contractions. Misoprostol does not prevent pregnancy and, therefore, is not used for EC. Combination oral contraceptives, commonly used for precocial contraception, may also be used for EC by taking multiple pills simultaneously to achieve the progestin level required to delay ovulation. However, the high estrogen content typically causes intolerable side effects, for example, severe nausea, and this method is less effective 47% to 89% than levonorgestrel pills.